moment we are following it up, it always has a room to correct ourselves or to improve. So for this one, I extend my thanks to Dr. Sadre. He's an animal and nutritional, he's into the animal health as well as the nutritional business management over last 10 years. And he has a well experience in implementing the successful strategy regionally, especially for the poultry. Also, he hold MCOM in the strategic management as well as the corporate governance, Bachelor of Veterinary Science and Bachelor of Business Administration also. He has started his career as a veterinarian, or you can say as a Vetco crest breeders in Zimbabwe. He's from Zimbabwe. And then as a poultry veterinarian at Lunar Chickens. And then he's a consultant for Techno Survey for the egg value chain in Zimbabwe. Also, he has worked with 5 Vet Animal Health as a country sales manager and veterinarian. He has headed the animal health business there. Currently, as an area manager for SADC, and also he has a lot of experience as far as the various geographical areas of Africa is concerned. So, Doctor, I welcome you, Dr. Sadrek, and thank you so much for accepting to deliver one webinar on the important or emerging topic, that is the management of coccidiosis, especially in poultry. So, Doctor, thank you so much, and the stage is all yours. The webinar platform is all yours. So you can share your screen and start your PPT. For the attendees, we are so sorry that certainly you cannot talk because of the webinar platform doesn't allow it. So, but certainly we have a question and answer tab down below. So you can just click. And if you have any questions at the end of the session, doctor will try to address most of them. So again, doctor, I request you to start this session.
Thank you, Doctor. I appreciate it. I still don't have the privilege to share. As the host, can you allow me to share my screen?
Yeah, you are allowed to do that.
I'm still not allowed.
Okay, there is a just a sec, doctor. Let me just let me help you out. Doctor, just try at your end.
Yes.
There is a green button down, share screen. From there, you can share.
Confirm you can see my screen, Doc.
Yeah, it's totally visible, doctor.
Just started at the wrong place, but as long as you can see it, it's fine.
Yes, doctor.
Good morning, everyone. Not too sure if it's morning for everyone, but it's morning for me. So I assume it's morning for everyone. We're going to look at a very important topic that I've had a bit of experience in the past few years. We have had very different experiences across the continent. I've had quite a lot of experience in the SADC region, mostly Botswana, a bit of Zambia, Malawi, and a bit of Mozambique. So my experience is mostly on the southern side of the African region, but a lot of the principles would apply to different parts of the globe, I assume. Coccidiosis remains a very controversial subject because the approaches are very diverse, if I want to put it like that. So it is a good platform to always have discussions around it and share notes on how others are handling it so that we can get on top of it. So just like any presenter, I would want to start by just a brief introduction of the disease. even though this can be done better by a college professor, I would do a good job of it just by briefly introducing it as just as a field vet. It will not be too scientific, as you might gather. So I think the main Armeria species that I've had to deal with in my region are mostly Armeria cervellina, Maxima, and Tenella. And by far the most important is Tenella in terms of causing mortalities, and by far the most important in terms of causing subclinical disease has been a cervellina in my experience. You'll find that the economic significance of these three, even though we have others that are also important, for me, these three have got the most economic significance in my experience in my region. This is important because we also have a lot of secondary enteritis that comes with coccidiosis. We have had quite a few cases of dysbacteriosis coming after or even during a coccidiosis outbreak. Necrotic enteritis, especially the one caused by Clostridium, that one is pretty much the most important one for me. I've had to deal with quite a few cases that came about because of coccidiosis. So control of necrotic enteritis becomes an important point within a coccidiosis discussion. So just a few little facts that we know about coccidiosis that can help us with the management of it. Firstly, we know that the reproductive cycle of the coccidiosis of the Armeria is 5 to 7 days. Even though we mostly see clinical signs from about 21, 28 days, I've seen a few cases that have come a little bit earlier than that, but mostly it's around that age. And it is important for us to take note of that reproductive cycle because it's important when we talk of one of the methods of controlling this disease. This fact remains the most important to remember, especially when we talk about the vaccinations. So generally for the disease to actually cause an outbreak, we need a few cycles. We generally won't have one cycle that causes an issue. We tend to have cycles. So it also speaks towards management of the poultry house. If you are able to stop the cycles going further, you actually have a leg towards stopping it without doing a lot, but just by controlling your environment, the litter management, that can actually get us started on the management of coccidiosis. So it's an important fact to remember that it actually does take a few cycles for the disease to actually start causing significant issues. So I'm sure those who have got a veterinary background, which I'm assuming is the majority, have probably come across this diagram in one form or another. And I guess what is important for us to probably just highlight a little bit is that when we get the unsporulated oocyst here, that's what gets into the environment. And we now need a conducive environment for this sporulation to happen. Remember, this stage is actually not infective. So we can actually have our control around this area, especially the poultry house, the housemen, the supervisors, the manager can actually help to control the disease at this point because this oocyst is actually not infective when it's not sporulated. But as the environmental conditions are conducive, the moisture, relative humidity, the temperature, we get sporulation. And at this stage, that's where it becomes infective. And as the bird picks it up, we then have the cycle starting. And we do have from scientific data that quite a lot of the processes that happen in the gizzard, including mechanical grinding, as well as the chemicals that we have like acids, gastric acids in there, help to this process to then happen, which then infects the small intestines. And it is at this point that I will not get into the specific details of the sporozoids and all of that, but let's just go into the general picture so that we focus a bit more on the management. What is critical to take note is that when this multiplication happens, the cell itself actually explodes. And we have a few cycles before it becomes sexual. So this exploding of the small intestine is very, very important because that is where we are getting most of our economic losses from. We actually have poor absorption of our nutrients, we have bleeding, we have inflammation, and we all know from gut health that when you have a lot of inflammation here, our absorptive capacity is also compromised. We then have the sexual stage at this point after quite a number of cycles that actually destroy our lining of the small intestine. And when we do get our sexual stage, we now get to the cycle starting all over again. So this is a very important table, diagram, if I call it that, for everyone to remember, especially if you want to control coccidiosis, because all the methods that we want are probably attacking a certain level of this cycle. And it is then important for us to then bear it in mind so that we stop this problem. I usually get questions as I go, but with the format of this webinar, we can type in questions as we go, and the good doctor will read out the questions, and then we'll answer as we go. So I think just to complete the picture, we probably know this is common knowledge that once we have that intestinal lining disturbed from the methods that I've shown in the previous slide, we have poor growth, which is quite obvious and in some cases very significant. We have impaired feed conversion. So we all know that 70% of the cost is going towards feed. And if you are actually wasting your feed, you then have a loss-making entity, and you move away from just being a veterinarian to actually being an advisor economically, because this is where the money comes from if you are growing chickens commercially. I would say personalized mortality rates actually speak to you being lucky, and I know it sounds a little bit off, but when you have birds actually dying, it's quite a significant indicator that you need to act. But a lot of the cases of coccidiosis are actually subclinical, and you tend not to get a spike in mortalities, but a very significant economic problem. And that for me is even more important, because at least if the birds die, you can start acting. You call the vet, especially those that don't have vets on site. You can call your vet, you can start acting. So yes, you do have cases where, especially with Tenella in this country and a few countries in Southern Africa, Tenella causes quite significant mortalities, whereas the other species cause quite significant subclinical infections. So the key, therefore, becomes early detection. So where mortalities are not spiking, but you're having growth issues, it's then important to then be able to detect that you have those cycles we talked about already starting to happen, so that you stop the disease before it goes too far. But remember, there's also a delicate balance, which we'll talk about as we go. Then you also need to use an appropriate vaccination program, which you can combine with all the other biosecurity measures that we know on site. But we will get into a bit more detail on that point. So as well, I'm hoping this is a recap for most of you, but we will go through it just to make sure we're on the same page. So we talked about severe enteritis being a major problem in cases of coccidiosis. We have seen quite some cases of bloody droppings. And as I said, in my region, Tenella is the major culprit. You do see frank blood. Then poor growth, we've mentioned that already. We have seen a few cases where there's actually respiratory signs due to ammonia in the litter, but it's not a common finding, really. So this, for me, is one of the things that I saw when I finished college a couple of years back now, and it was alarming because you see it ballooning sometimes 2-3 times its normal size, and you have frank blood in there. And those who have used lesion scoring before, this is probably what you classify as a 4 on the lesion scoring. And this one causes quite significant mortalities. You have loss of blood. You have all sorts of issues with growth. But this is usually tenella. In fact, I would say it will always be tenella in most cases. So you can imagine the damage here to repair it, even after treating it, is not very easy. So you tend to have secondary infection coming in after you've already lost quite a lot of production from the coccidiosis itself. So I think I've already mentioned that subclinical infection is actually the most common, in as much as the one that causes mortalities is more dramatic. This one actually, the subclinical infection is actually more important in my view, and it's actually more common. And then we go on to the clinical signs, especially when you talk of the subclinical infection. You can actually be seeing what somewhat looks like healthy birds, but those who are really observant might see ruffled feathers, might see that there's an effect on consumption of feed or even water sometimes. But overall, to the inexperienced eye, there's generally no clinical signs with the subclinical one. And it's actually difficult to detect sometimes even in the droppings, unless you're really looking for it. So therefore, that you tend to see effects on the FCR, growth, and just overall flock health, which sometimes a lot of people don't point it towards coccidiosis, as it might not be top of mind. And there comes the major issue here, which is the secondary infection that usually comes, especially from Clostridia, which causes our necrotic enteritis. And therein comes in with a lot more issues at that point. So being in the field, I've got clients who have large numbers, up to 200,000, 300,000, million birds. But you do get cases like in this case, they had 5,000 birds. And you can see how this environment is. And we had a serious challenge with this farmer because the level of poxy that was here was alarming. These birds were 2 weeks over the day that they were supposed to be slaughtered. In the Southern African region, we normally work with about 35 days. So from about 33 to 35 days, we are targeting about 2 kg bird for slaughter, sometimes 1.8, 1.9. And in this case, this was already day 48, and the birds were now averaging 2 kgs. So you can imagine what was happening with the FCR. But the major culprit in this case was now coccidiosis. And initially, they didn't have too many issues because they also had a coccidiostart in the feed. But now they were at the finisher stage, and that's when we had an outbreak. So you can see it's wet. They still have the brooders in there. They're using the electric infrared lights. And so the temperature is right, the humidity is right, and you can see the moisture within the bedding is definitely above 35%. So you can actually have very good cycling here. So this is one of the things that you see, especially with the inexperienced farmers, the small scalers. You tend to have this being the major finding. This is also one particular client that I found fascinating because each of these open-sided houses, so for those that are not in my region, you probably would have a lot more climate-controlled houses. But in this region, I would say the ratio of climate-controlled houses to open-sided houses, which are naturally ventilated, is about 80-20, I would say. So majority is actually open-sided houses like these ones. So this is one of my clients who I only joined after they'd already built this site. And one of the major issues that got us into issues with coccidiosis was that this was a very significant hill. So you can see the slope here. They tried to level it a bit, but you can still see that it's quite steep going up. So the challenge was that whenever it would rain, the water would actually flood and get into the house. You would actually be sometimes almost a gumboot deep in the water And when it drains a bit, you would always have coccidiosis outbreaks, and Tenella would be the major culprit here. So in this case, it was quite a nightmare to manage this. We had to then work on trying to sort this out, but we would always have coccidiosis outbreaks in the rainy season. So some of the issues that we have actually come from how a site is constructed. Usually you don't have too many problems the last 2 years, but these two we had serious challenges. And it took us a bit of time to get on top of it. We are using different chemicals, and yeah, it was a challenge, I would say. We will talk about some of the methods we used to control these outbreaks in this particular case. So this is another small-scale farmer. This house contained 2,000 birds. And you can see this is poor management. And I know for some of you who are in advanced economies or in advanced places where management of poultry is way above this, you'll be surprised that I probably see this at least once a month. Even now with all the trainings that are done in the countries that I operate in, you still have some small scale guys who take shortcuts and really don't know what they're doing, and you end up with pretty much muddy puddles in the middle of the house, and now you have birds that are struggling, and we had serious issues with coccidiosis in this case as well. So I think from my discussions with Dr. Amadip, we wanted to delve a bit more into the practical side rather than the science of it, if we could. So this is me a few years back, working in the lab at this point. So I think for most veterinarians, it is important to be able to have a site that you can look for the oocysts, do oocysts, your oocyst counts. A lot of places it's very difficult to transport your samples in order to do oocyst counts. But it would be, if it's possible, this is actually a place that's actually easily accessible for me. So diagnosis becomes easier and faster. Remember with coccidiosis, because of the economic losses, we want speed in terms of our diagnosis. We don't want to be waiting a couple of days when we're already seeing the losses. So you can have fecal flotation. I've done that a few times myself. But I think in the field, it's mostly based on postmortem examinations. It's fairly easy to actually see. But remember, you also then now need oocyst counts when you are looking at monitoring vaccinations and all of that. So there are different methods of lesion scoring. I personally use the 1 to 4 scale, especially for Tenella and Acevelina. So different literature would define it differently, but it's important for every vet to adopt their own understanding of it and make sure that it's standardized within your operation, especially if you're not operating alone, so that you sort of have the same result all the time. I would advise everyone to have a reference sheet. I've got a chart myself that I've got on the wall that actually defines what score 1, score 2, score 3, score 4 means and what actions to then take. It will then help in the determining whether we are going for chemical control, we are going for just ionophores, which are coccidiostats, or we actually need to also have a combination of vaccines and probiotics and everything. So this part of diagnosis for me is central in then coming up with solutions in terms of managing coccidiosis. So I know quite a few vets in the field that actually just rely only on the postmortem. Whilst it works, it would also be important to have other methods added into it. So we'll go to then the management that we need to have a bit more on. So we do have the chemical coccidiosides, and then we have the in-feed ones, which are usually coccidiostats. So with the chemical ones, we are looking at pretty much clearing everything. We do have different classes of drugs. Some can clear all the stages. some can clear certain stages. So it's important to also know the distinction that this drug might actually not remove everything. And then you have coccidiostats that generally don't actually kill, but they stop it in the track. So it therefore means that there's actually a little bit of infection that is allowed to prevail. And then you've got live vaccines. You've got the attenuated and the non-attenuated vaccines. And then at the moment, we now remember we said the secondary infection. So a lot of my programs now involve a bit of a probiotic in it for quicker recovery. And then you can have it separate, but you can have it as a combination as well. Right. Where's my next slide? Right. So I think the first group of chemicals that is available to us is the chemical treatment. These are synthetic products. We have different classes. It's been a few years before we got the last compound. I believe it's way more than 20 years now. So this has been the hallmark of treatment, especially when you do get an outbreak that is severe and you want to stop it. So these ones pretty much sterilize the gut of the Eimeria. And this class of drugs is mostly available as prescription products. And I know Ashishi has got Amprolium and I think Tutrazorium, if I'm not mistaken. And these remain very effective drugs in terms of chemical.
Sorry, yes,
Sorry?
we do have Amprolium as well as Toltrazolil with us.
No.
Yeah.
Great, thank you for that. So generally speaking, you do have your Amproliums can be 3 to 5 day treatments, depending on the severity. Sometimes it can be beneficial to have a vitamin A and K supplementation, usually to help with the rate of recovery. And then, so Amprolium and Tutrazolium. Tutrazolium usually is a 2-day treatment. I'm not too sure of the Ashishi offering if it's exactly the same, but most of my experience is 2-day treatment with Tutrazolium. We do have sulfur-based drugs as well. They do have their limitations as well in terms of what they can kill. And then you do have Tamlin. This one does have a lot of limitations, especially in the breeders, because of the tendency of toxicity. Especially if you combine Tamlin with your coccidiostats, especially your ionophores. We have had quite significant cases of Tamlin causing significant mortalities after the feed mill did not flush after producing, say, broiler feed that had coccidiostat, and then they started producing breeder feed which had coccidiostat, which shouldn't have coccidiostat because they are vaccinating, and then maybe they've had to treat with Tamlin, and we have had quite some nasty cases with breeders and layers as well. So it's important that if you do decide to use Tamlin as a chemical, that you know that there's definitely no coccidiostat in the feed. So this remains a very important part. The challenge that comes with this method of treating is that because it's very effective and it actually sterilizes the gut, it then brings in the challenge that resistance can come in quicker. So there's need to then rotate these drugs so that you can still have them working effectively. So you need to rotate them. Resistance has become quite a significant issue when it comes to coccidiosis. And in some countries, we do have limitations on the drugs that you can use because of this. But I know some places you can easily qualify and say these can only be used, they only have veterinary application, they don't have human application, so they can have an exception. But resistance should be at the back of your mind as you use these drugs, so that you don't overuse them, because resistance comes in quite quickly. It's also important to bear in mind that these withdrawal periods to consider. So if you're working with broilers and those that are not long-living birds, you need to bear in mind that you can have issues with withdrawal periods there. And then with some drugs like sulfur drugs, they can even affect egg production. So you need to just be aware of the side effects that tend to come in that. This is not an exhaustive list. I've just given examples so that we have a clear picture of what we are working with when we are talking of chemical treatment. So this is what I would call the last resort. You have tried everything else, and you can see that this is too severe or the losses are too high, and you now need to clean the intestines of the same area. So this is an important one to actually consider. And then the second one, which is by far more widely used, especially when you look at the short life birds like your broilers, where you don't have a long time to actually have the cycles to be effective. So you find that in my region, we still have quite a lot of drugs that we can still use in the starter and grower diets. Generally speaking, you don't have them in the finisher diets to allow for the withdrawal period. And it's also an important point to bear in mind, because some of the outbreaks I've seen, like I was mentioning when I was showing that picture, some of the outbreaks have actually come within the finisher period where you've withdrawn the coccidiostat. So it's important to know that that can be something you can pick up from the history to say they are now on the finisher diet that might not have the coccidiostat. So the coccidiostat doesn't actually clean the intestine like the chemical treatment that you mentioned in the previous slide. These actually can allow low-level infection. So this then remains important to then have your management being right, because stressful factors within your house, in your environment, can tilt this balance of low-level infection to actually high-level infection. So you have to understand that when you talk of coccidiostats, this is not the end all of treating. It's part of what we need to control coccidiosis, because this is not enough on its own, but it does give quite significant control. So this is less used in long-living birds, mostly those that use vaccination, because remember, the coccidiostat can also affect the cycling of the vaccine. So whenever you are doing this, make sure that you are not using coccidiostats when you're using vaccines. I've also had quite a bit of experience where, like I was mentioning, in a severe case where it was a combination of Termlin and coccidiostat, you also find that, especially in operations where they do not have control over what happens in the feed mill, it's not a vertically integrated operation. Sometimes you have broiler feed coming in before the breeder feed, and you tend to have residues of the coccidiostat, and then it actually affects the cycling of the vaccine in the house, and causing serious vaccine failure after spending so much money and attention to it. So it's important that if you are using an external feed supplier, that those things are actually monitored. And generally speaking, where I've operated, they tend to produce the breeder feed first thing in the morning, post cleaning of all the beans and the mixers and everything. Sometimes they run a flush, 1 ton mix of flushing. You can use what's it called, bran. You can use any bran, sometimes combined with organic acids. You run that first, and then you do your breeder feed, just to make sure that you don't have any remnants of coccidiostats in there. And then also these coccidiostats, remember we talked about resistance with the first group of chemicals, which can happen quickly. Here it's a little bit slower, but still it's very common. So you also need to use these drugs on a rotation basis. You shouldn't use the same class of drugs to treat. You need to rotate them. And then usually we work with about a 24-month cycle, changing every 6 months. So depending with which drugs are allowed in the country that you operate in, you can have a shuttle program, or you can have a rotation of these drugs over a 24-month period, doing a 6-month rotation. So it shouldn't be the same chemical or same class of chemicals. So we're actually changing the class of chemical in terms of the procedure start, depending on what is allowed in your country. So you have different examples that we can mention, but I'm sure you're already aware of quite a few of those. So I think we'll get into what in the modern day has become a bit more common, especially in the long-living birds, which is vaccination. So you find that we have two main vaccines that can be used. So the live attenuated or the live non-attenuated. There are some countries where they still have had to use the live non-attenuated. These are still harsh. You still tend to have outbreaks if it's not well monitored, but sometimes they've had to weigh the cost benefit, because they probably be having very significant cases of coccidiosis outbreaks. So it then becomes important to go on those non-attenuated. But the attenuated is becoming a bit more common at the moment, as long as you can manage all the other environmental factors. These will allow a lower level of infection, but at the same time colonizing the intestine. And this then can actually be used together with your rotation program in some places, where they actually can use vaccines here so that they give a break to the chemicals. So it can also be used like that. When we talk of vaccinations, back when I started off in my career, a lot of it was being done in the house, and it was always a challenge. How do we ensure that every bird has received the vaccine? And you are having to spray in a house that's quite big. And remember, in our case, we also have a lot of open-sided houses. So how do you manage the relative humidity? How do you manage all of these things in the poultry house? So now more and more is being done in the hatchery, and it gives a better take. It can be spray. Some have even gone on to use gels. I've had experience with both. And you can have a lot of preening happening, and then you allow for the cycling. The first 7 days, you have the first cycle, and then you have another cycle. So remember, with the vaccines, the immunity is also species specific. So you need to ensure that you know, especially your main issues. Like I said, in my region, we have a lot of Acevelina, a bit of Maxima, and Tenella. So you can have a bit more combinations, but you need to make sure that you have the problem strains within your vaccine, so that you cover everything. There is no cross protection that has been recorded yet, unless there's literature I'm not aware of. So you need to be well aware of which vaccine is being used. So for those who buy, I know, like in my country, you have got a few breeders that actually buy their day-old chicks from another country and fly them in. So it's important for those veterinarians or managers working on those sites to actually know which vaccine has been given, to ensure that they are covered, because there's no cross protection. And then this comes with a significant management challenge for the poultry housemen, because now, to ensure cycling, you need to ensure that you've got everything in place. And by that, I mean, you need the ideal moisture level, especially in the top 5 to 10 millimeters of bedding, or liters, if you might call it that. So usually we want it to be, the moisture, we want it to be about 25 to 35. mostly targeting 25%. And then the relative humidity is usually around 60%, although it can be 60 to 80%, really. It's not a strict rule. And then you need to monitor your stocking density so that you ensure that they are in the same vicinity in order to be getting the oocysts and cycling them to ensure that the vaccination actually works very well. And then I still have some farmers who still do broadcast feeding, and that actually can help with the cycling of the oocysts, because as they are feeding from the ground, they actually can pick up the oocysts quite better. But some have moved away from it. So it just depends with how we are operating. So when I also started in my career, a lot of guys were also using spraying the vaccine on the feed, but there were quite some very varied results with that. So I wasn't too happy with the lack of control over that. So it's also another way of vaccinating, but for me, it wasn't the best. Then usually when you're doing this, remember you need to then monitor. So I was talking about it a few slides back, where you need to be monitoring. So even though we say the cycling is 5 to 7 days, you can monitor every 10 days to ensure that you still have the cycling happen. These vaccines are quite expensive sometimes, so you don't want, after having done all that work, for the vaccine to fail and subsequently to actually have an outbreak that causes serious economic losses. So you need to protect the vaccine that you have used, if you have used the vaccine in your case. So whilst we are mentioning, so there are many other aspects we can talk about on the vaccine side. But I think it's also important to address the fact that whenever you have coccidiosis outbreaks, you tend to have a significant secondary infection. So sometimes when you've used the Amprolium, or you've used the Trazodone, and you've cleaned your intestine, sometimes you then get quite significant dysbiosis, because you have upset the balance at times. So you find that now more and more, even in my experience and in my consultations, incorporating a bit of antibiotics and probiotics in it to try and help recover the gut health as quick as I can. Especially with necrotic enteritis, you find that you can actually get quite a few products that can work against the colonization of the intestines by the Clostridium. They colonize faster, and then it actually makes the environment better. And some products as well that I didn't mention can also help with inflammation. So if you can lower the inflammation, you know that you don't have a leaky gut, which can then affect growth. So we talked about coccidiosis affecting growth significantly, and especially in broiler operations, your growth is what makes your money. So it's important. So I've already mentioned excessive inflammation coming with that. So there are some products, natural products out there now that can also be used together with your chemicals, treatment, together with your coccidiostats, together with your vaccines, to try and help with the gut health. Once you have good gut health, you can get your weight back, your weight gain back, your FCR back. So like I said, generally speaking, in my experience, using a rotation program of the different methods also helps. So you are using a chemical there on a certain case. You are also using ionophores in certain cases, which are also rotating. You're also using vaccines in certain cycles, so that we do not have resistance that actually stops us from having chemicals that we can use when we have problems. So all of this, a lot of the other methods have come in because of how the Emeria species is actually quite good at developing resistance. So we then have not too many options to work with. So it is important for us to recognize that if you use a vaccine rotation program, it can help preserve the chemicals that you have. because we have not had new chemicals for quite a long time now. So these will vary, farmer to farmer, circumstances, cost of drugs, cost of vaccines, all determine that. So you can factor in which whatever is important for you and the farmer to design a program around that. And I guess what's also important is that with a lot of my clients, they do not have control over the feed mill. So it's also important to know that if they are using coccidiosis, you also have your own control methods on farm that you can control. With the feed mills, I've worked with quite a few, and they all follow that. Some also, in addition to the ionophos, you'll find that some countries still allow products like zinc bacitracin, which then caters for the necrotic enteritis. But some places have actually banned drugs like that, like zinc bacitracin. So you tend to be exposed after clearing your coccidiosis. You tend to have your necrotic enteritis causing problems after that. So there's quite a lot to talk about when it comes to coccidiosis, but I've tried to see what I can put in an hour, and then we can discuss in question and answer session. So yeah, thank you.
So much, doctor, for this, going through your practical experience. As you were talking about, use of checking the secondary bacterial complications. So we do. Can you just go to that slide where you mentioned about the treatment, where you mentioned
Oh,
that,
sorry, let me put it back up.
yeah, sulfur drugs can be used. So like the sulfur drugs can be used. The treatment slide.
The treatment slide off.
So evenly now, when we were interacting, when we are into the field, we were interacting with few of the poultry consultants. So there is a trend that they are using sulfadiazine with trimethoprim combination kind of drugs. Like we have Astrisul 480, which is a double strength. So they were using this kind of product. So where they had a very good result, especially to check the enteritis also. So any comment on that? Like when you are using either amprolium, or whether you are using toltrazuril, and in that you are using the products like astrisul, like sulfadiazine plus trimethoprim combination, especially that goes with enteritis.
Sorry, I'd lost you for a minute there, but I'm back now.
Doctor, I was referring to the treatment protocol where you mentioned that certainly to check secondary microbial complications, we have to use antimicrobials. So few of
Yes,
the consultants, they were, they have very favorite products like the combination of sulfur with trimethoprim.
yes, okay,
So
good.
we have a very good product, which is a double strength, that is Astrisul 480, which has sulfur plus trimethoprim in it. So any comment on that, that when people are using these kind of products along with the amprolium as well as with the toltrazuril kind of product, especially for the treatment of coccidiosis?
I'm struggling to hear a little bit. I'm not too sure why.
Yeah. Am I audible now properly, doctor? But meanwhile, all the attendees, thank you so much for joining. If you have any question, your questions are always welcome. You can just put it on question and answer session. Doctor.
Yes, now I can hear you. So let me look. I'm trying to open the questions here. So I can see one here that's saying
Yeah.
multivitamin, especially vitamin B complex in kids, affects efficacy of amprolium. So I think that's exactly right. What I've found is that these chemicals like amprolium, you tend to use them more when you have had serious issues. So when I've used them in my experience, I've not had to change anything in the feed, and it has worked well. So I think when you do the scientific research, you do come across it. I've seen it in some articles, but on the ground, when I've added amprolium to treat, it has actually worked without any issues, without having to change formulation of vitamins in the feed. So that's from my own experience.
Yeah, doctor, there is
And then
a question from
and then the sorry.
one more question from Victor Richard.
So there's that one, yes. Sorry, can I highlight more in complex methods of coccidiosis, ionophores plus synthetics? So in that case, it's quite fairly straightforward. So remember, especially in the broilers where you have short-lived birds, you can have a situation where you've used ionophores, and now and it's mostly when you don't have control over what's being put in the feed mill. You know there's an ionophore, but you're getting an outbreak. So now you're being forced to use synthetics as well. Where you can, you try to get the knowledge on the ionophores being used by the feed mill. But a lot of the times, it's actually very difficult to get that information for the farmer. I've had very good relationships with the feed mills, so sometimes I know which one is in there. But for most farmers, they actually don't know. So you then know that it's actually now a combination of ionophores that are already in the feed, and now you're having to put a synthetic because you still have an outbreak.
Yeah, let me take this question. Yeah, Michike Girma, he has asked for the training material. So certainly this after this webinar, we will be podcasting this into our channels, YouTube channels. So there you can get this one. So
Yeah.
certainly,
Then
doctor cannot share the slides because these are confidential one. He has gained the slides. Okay, so certainly there is one more question that where can I access the vaccines?
So vaccines are supplied by different companies, obviously because it's an Ashish webinar. We'll not get into too much detail, but a lot of the multinationals have got offerings on these. So just so that I don't do disservice to Ashish, I will not get into the details, but most of your multinationals actually do have this.
Yes. There is one more question, doctor, that the question is related to how we can control and manage the necrotic enteritis. I guess the best answer is again one more. Sorry to interrupt, but the one of the best answer might be to use of our product like Astrisud 480, where
Yes.
particularly it acts on the necrotic enteritis, doctor. Yeah, doctor. Any further points you want to add? You are welcome.
Yeah, yes. So, like I was saying, now you can use those chemicals that the good doctor has already mentioned. Now, because it's also a gut health issue, you want to make sure that you control your coccidiosis because this comes in after the damage of the intestines. So if you can control coccidiosis, you have solved half of your necrotic enteritis issues. If you can take care of your gut health, you can also solve quite a significant portion of your necrotic enteritis problem. So that's where we are starting to also now have things like probiotics coming in. Some places you can put the probiotics from day one of placement, and then that actually helps gut health. So necrotic enteritis, now the hallmark is all around gut health. And then where you have serious issues, you go for the chemicals. And then which controls perform better in at least 3 coccidiosis etiology? So you find that when you are using the chemicals tend to kill all of them. All the etiologies that you have, the chemicals, your amprolium, your tretrazole, generally will kill all the species. We do not talk of being species specific. We only talk of being species specific only when you talk of the vaccination. So I'm assuming here that if you have an issue with coccidiosis and you have 3 different strains there or etiologies or species there, you can use your chemicals, you can use your coccidiostat, but if it's the vaccine, that's where you need to make sure that you have all the 3 strains in there. And then the next one. So there are various examples of probiotics, and like I said, for the vaccines as well, I'll do a lot of disservice to Ashish if I'm to go through that. But there is quite a number of products. Some are specific to Clostridium, and some have broader action. I've actually personally used about 4 of them with very good success. So Yeah, there's quite a lot. Prostart from Chemin. So if I'm hazarding to say, Biomine and all of those, they've got a lot of offerings there. So
Rather than
if you
taking
Google,
company
you'll find them.
Doctor, sorry to interrupt, but we can just tell about the probiotic name like Bacillus, Subtilis, evenly Licheniformis, they can use Streptococcus faecalis are there, Lactobacillus acidophilus are there, evenly they are very commonly available. So these are one of the predominantly used probiotics which Richard has asked this question just to precise that
Right.
what are examples what they can use.
All right. Yeah. So I think that question is similar to one that I've already answered from Samson. So I'll go to Hail. Vaccines are not widely used. What do you think is the reason in terms of effectiveness in the control of coccidiosis? So, like I was explaining with vaccines, the first issue is the cost. If you compare the cost of, I will not mention the actual vaccine, but if you compare a typical Newcastle and IB vaccine, which in my region can be around $6 for 1,000 doses, the coccidiosis vaccine for 1,000 doses from that manufacturer is actually $90.
Mhm.
So typically a vaccine is $6. This one is actually $90. So the cost is quite high if you look at it. So that's the first issue. The second issue is that you need to be a bit more knowledgeable in terms of how to manage the cycling. So you find that a lot of people might say, I don't have enough expertise to understand this. Let me just go for the chemicals. So you need to understand how the cycling happens, and you also need to be able to monitor. And some people will say, I might not be able to monitor. So that's why you find that there's a lot of issues around vaccines. Then the last issue that I think is affecting the adoption of vaccines is that there are some people who have used the non-attenuated vaccines. And when you've used the non-attenuated vaccine, it can actually cause significant mortalities if it's not managed properly. You can actually have issues, serious issues. So you need to be someone who's well experienced and well versed in these things in order to be able to use, especially the non-attenuated vaccine. So I would probably think those are the few reasons that I can think of in terms of why vaccines are not widely used. And remember, when we are also comparing the chemical control versus the coccidiostat versus the vaccine, there's also a significant difference in cost. The coccidiostats being the cheapest, followed by the chemicals, followed by the vaccines. So the cost difference is quite high. So a lot of guys might just go on the cost side and look at the first two, which is the chemical and the coccidiostats. Which way of treatment do you think is best for small-scale farmers? So small-scale farmers, traditionally, at least in my country and the countries in my region, in the Southern African region, it's almost a standard by all reputable feed suppliers to put a coccidiostat in the starter and the grower. So the small-scale farmer already has the first line of treatment within the feed that they buy commercially. And then the second part is then to be able to get like the hashish products that the good doctor was mentioning. So you can have your Emporium and all the other products that he has mentioned. So those are easily accessible to the small scale farmer. And I know hashish also has small packs that can be used by small scale farmers as well. So the next one. Few weeks ago, I've treated my flock with Aprolium. Following the administration, I was able to see watery diarrhea. What could be the possible cause of this? What do you think? So I think this is a typical case of secondary bacterial infection. So remember, when you treat with your Aprolium, there's usually an upset in the intestines, and you tend to have the bird now being predisposed to what we call dysbiosis. So it's already another topic that has quite a lot that we can talk about. But dysbiosis actually means our gut health has been affected, and now we need to correct it. And that's where you can come in with things like probiotics to help to recover that. So you need to look out even for necrotic enteritis, if that is what is happening. So it's a bit difficult to tell without me having done a post-mortem or having done any microbiology work on it. But I would highly suspect that the watery diarrhea is coming from the secondary bacterial infection in the gut. From the discussion, it's obvious that there's high resistance of the Armeria species. So antimicrobial resistance is an issue that lies ahead of us. Is there any way in the space of organic substance for usage, substances like phenonia and all of that? So I've in my professional career, I've actually worked with companies that are actually now specialized in this. So there are some countries, like in my region, Botswana has already banned antibiotics, and a lot of the chemical chemical control products that I talked about have also been banned. So now you have these alternatives coming in. I will not go into the details of those, but they're actually available. But the major obstacle at the moment is the cost. The difference between the products, petroleum and all of that, and the new natural products you're talking about, organic products, are way more expensive. And some people have actually done studies that are not published where they found that when you are having to use these organic chemicals and you then end up having an outbreak and you have to do chemical treatment, the chemicals now work better because you've just been using alternatives. So yes, there are quite a lot of options that I could mention, but just because it's Ashish doesn't have those options, I will not mention them, but there's quite a few that I'm aware of. Then what is the advantage of using a raised house over the floor-based house like the one we have been showing in the PowerPoint? Then secondly, with the break of the disease cycle sometimes involve killing the animals. So I'll start with the second part of the question. Killing the animals might not help a lot. Remember, it's producing a spore that is highly resistant. So in this case, when the animals are gone, the spore is not gone. You still have it. So you generally don't have that as an option. You actually need to get rid of the spores as much as possible and just have, especially if you are using vaccinations, and just have strains that you know you can control. So I would say the second part, no, it's not part of the control measures because the spores will remain and they're very resistant to a lot of weather conditions. So you need special chemicals to make sure you destroy the spores, and then you can work on the other methods we talked about. Then the first part is erase the house. Yes, if it's the droppings are going down, like when you have the cages, that definitely reduces coccidiosis significantly. So where you have cages, you tend to have less outbreaks of coccidiosis, yes. But in some places, they still want to have control, so they still have low level of coccidiosis infection that they want to maintain in the flock. But when you have high-rise houses where the bed actually goes away and they never get exposed, you have lower chances of coccidiosis, yes. Is it correct to use drugs like Astro to combine with multivitamins during treatment period, or you can lower the immunity of drug? I guess you know this drug better, Doc. You can take this one.
Yeah, thank you. Thank you, Sheeta, for asking this question. So certainly, when there is a coccidiosis or when there is any kind of infection, the bird's immunity is always at the top. So how the response will be there? See, certainly as a vet, we have to first remove the main causative agent, and then simultaneously we have to take care about birds' health. And once it is up to the mark, and then slowly we have to start about the antimicrobials. Certainly, there are few references are available where people immediately start combining both the drugs, like to check secondary bacterial complications as well as the anticoccidial drugs. But that depends on the herd or that depends on the bird's health perfectly. So depending on that only we have to go with our treatment protocol. So I guess this will be the answer of the question. Doctor, if you want to add any point, you're always welcome if I miss any point. answering
I think I'm satisfied. I'll take the next question.
that, please.
There's a lot of Familiar species affected parts of the intestinal tract. Why effective the vaccine is against all these species? I'm not sure I can follow very well. But I'm assuming the question is to do with the different Familiar species in the vaccine. So yes, the course of the vaccine is determined with the type of strains that or species that are in the vaccine. So you find that if you want to get something that is all the strains, it is way more expensive than one that is only the strains that you feel are affecting your operation. So I guess the major issue is to do with the cost component. I hope I got that correct in terms of what the question was asking for. The second part is there any effects of anticoccidios on egg production, fertility, and hatchability? Yes, there's been a few cases where, especially when you talk of commercial layers and layers, where especially if you use products like your sulfonamides, where there's been a depression in egg production, yes, there are some that can have that effect. So what is important is actually to be able to prevent rather than have to treat. But others products like Amprolium have not had any effects on egg production or hatchability or any of that. So it's mostly on egg production rather than on fertility and hatchability. Hatchability and fertility might just be affected only in cases where the birds are very sick and you actually don't have fertilization actually happening. The cocks are not working very well, things like that. But in terms of direct effect of anticoccidios, the one that I'm aware of is that sulfur drugs sometimes can have effect on egg production, yes. And then the last part of this question is that you've explained that you should never combine ecosystem with a vaccine. Yes, because remember, the principle of the vaccine is that it's actually a live vaccine that is actually cycling in the bird and then produced in the droppings and into the litter and then eaten up. So we're actually cycling this vaccine so that it colonizes and that one can be treated better if you need to treat. So if you use your coccidiostat, you're actually affecting that cycling. Yet you've spent so much money on the vaccine to try and get that cycling of the vaccine happening. So you don't want to be using a coccidiostat when you're using a vaccine. Are vaccines and probiotics compatible if used at the same times? Generally speaking, yes, they are compatible. In most cases, you actually a combination of the two being used because now you probably can have issues with gut health, but you've put a vaccine in there. So yes, you definitely can combine the two.
Doctor, there is one more word of praising. So I guess the attendee doesn't want to praise or doesn't not to praise, but doesn't want to reveal his identity. He just mentioned that there is no any as of now the question, but he wants to appreciate the efforts of Ashish Life Science for organizing this kind of knowledge sharing. So thank you, anonymous attendee, for this kind words. And let's quickly have the last question. Doctor, it's up to you, which is asked by Richard.
Sorry, I didn't hear you there.
The last question, which is
Yes.
asked by Richard, is it possible to use layers, say like 50 weeks old to 100 weeks old, to have coccidiosis?
It is possible to have it, but it's not common. But it is possible, yes.
And the second part of the question is, can it be extremely detrimental and having adverse effect? In such cases, how to control them?
Most cases are not extreme and they are not devastating because these birds will probably have cycled coccidiosis one way or the other, whether it was delivered through a vaccine or it was just through field infection. Chances are at that age they've had cocci going through and they tend to have higher immunity at that point. Where you've had detrimental effects is where the birds were consistently being cleaned by chemicals throughout the 50-week period, and then they've not had enough immunity developed. But a lot of the experience I've had with all the operations, by the time they get to 50 weeks, they've had quite a good immunity, whether it's natural or is artificial through vaccination. So controlling would then be similar to what we talked about. So most of the time it's chemical control. If it's layers for human consumption, your options are limited because a lot of the chemicals have got a significant withdrawal period that you actually have to dump the eggs. But if the outbreak is bad, you might be forced to actually dump the eggs and treat. Specifically what antibiotic can be used, probiotic can be used. There's quite a few that like I said, I won't mention the actual names because it'll be going against Ashish that have sponsored this. But there's quite a few probiotics around. Some of them are specific to Clostridia, and those ones would be quite good as well. And then some that are a bit more broad. But those that I've used are mostly against Clostridia, and they work very well.
Yeah, and thank you, Emmanuel, for your kind words. Doctor, he wants to praise about your presentation. So he's thanking for
Thank you.
presentations. And certainly all the attendees, thank you so much that you guys are always encouraging us to make these kind of webinars or to arrange these kind of webinars. Certainly, as Ashish, we have lot of products which will be specifically helping the poor farmers or the marginal farmers to, like as doctor was mentioning, that for marginal farmers, and somebody pointed out that for small scale farmers, what will be the remedies and how they can manage. So certainly Ashish has smaller packings also, and we have a lot of products which will be helpful for increasing your productivity. So on this platform, I sincerely thank all of you for taking out some time from your busy schedule to attend this knowledge sharing webinar on such an important topic for coccidiosis. So doctor, on behalf of Ashish Life Science uh, and the whole family of Ashish Life Science, I extend my thank you so much for your time as well as for briefing us about the coccidia and giving us, the practical approaches for the management of coccidia. And uh, so with this note, evenly we are coming up to our last session, which is very important. That is the lucky dip, where we will be announcing three lucky dip. So Smita, it is over to you. So doctor, if you want to say something before ending the session or before going to the next thing, the if any comments, the last comments from your end.
Just to say thank you for the opportunity to present. I think it was quite good to be interacting with all the participants. And thank you for the opportunity.
Yeah, you're welcome, doctor. Yeah, Smita, over to you. So these are the attendees name. So let's hope for the best. So here is the winner number one. I'm keeping my finger crossed for my name. Oh, welcome, Mr. Patricia. I don't know whether Patricia. And soon our executive who is into that area will be in touch with you. So thank you for attending this session and congratulations. So let's have our second winner. Congratulations, Hello Zeru. Thank you for your time and heartiest congratulations to you. Soon our executive in your area will be in touch with you. Now let's have our third winner. Congratulations, Orestus Kamoto. So soon our executive will be in touch with you. The Ashish representative will be in touch with you. And thank you so much for everyone for you taking out your time.